there has been a sudden surge in cases of a serious mystery illness in children we've been telling you about, believed to be related to COVID-19. At least 64 children in New York have now been diagnosed with the syndrome so far. Tonight, pediatricians around the country being alerted to the mystery ailment and its symptoms amid worries the cases so far represent just the tip of the iceberg. And that's where our reporting begins tonight with Kristen Dahlgren.
Within hours of an urgent call for parents and pediatricians to be on the lookout for the mysterious complication in some children, the number of cases ballooned in New York State.
I understand why parents would be anxious. I think everybody should be.
64 children in New York have now been diagnosed with what is being called pediatric multisystem inflammatory syndrome, believed to be a response to COVID-19. The rare complication marked by fever, red eyes, rash, or upset stomach, and in some cases, cardiac arrest. Late today, the American Heart Association putting out an advisory to pediatricians. Dr. Jane Newberger from Boston Children's Hospital says she's never seen anything like it.
You were on a call with 1,800 other doctors from around the world. How concerned is the global community about this?
Well, I think the global community is really concerned because this is a brand new event.
8-year-old Jaden Hardawar had no pre-existing conditions. His family and pediatrician never even knew he had COVID-19, but he ended up on a ventilator in the ICU after his heart stopped.
Right away, they started applying CPR on Jaden. At that point, I grabbed the cell phone and called 911.
These cases are rare, but they seem so severe and so unpredictable. What does a parent need to know?
So I think most parents, first and foremost, need to know that this is rare. And at the same time, they shouldn't fail to seek medical attention if their child is sick.
So far, no deaths have been reported. The CDC says it is now studying the syndrome, trying to learn more before more children get sick. Kristen Dahlgren, NBC News, New York.
Now to the race to reopen and the deep and sometimes confusing divide that's causing, with the virus still taking many thousands of lives each week. More than half the country is carrying out plans to get people back to work, while others simply defy the rules. Here's Miguel Almaguer.
With our nation anxious and cautious about getting back to work, tonight the delicate balance between protecting the health of Americans and the economy is creating a deep divide. After the highest single-day death toll in Illinois, stay-at-home orders remain in effect. But in East Peoria, the mayor is urging businesses to ignore the governor's orders.
If we don't follow state guidelines, we could get some huge fines.
The mixed messages playing out nationally come as some 10,000 Americans died from coronavirus complications every 5 days over the last month. In Texas, where COVID cases surged 35% since last week, the defiance has led to detention.
I'm not closing the store.
After Shelley Luther opened her doors in Dallas, a judge put the salon owner behind bars for 7 days. At this West Virginia barber shop, customers are crossing the Pennsylvania state line to get a haircut. In California, this was the scene to get into a mall that should not have been open.
With the lockdown looming over businesses in Los Angeles, more and more say they won't survive the crisis.
Tonight in states like Alabama and Utah, shopping centers are opening their doors. By Sunday, at least 43 states will have completely or partially reopened. In Mississippi, where the death toll just hit a high, there is an appetite to return to restaurants.
About as excited as an 87-year-old man could get.
But there is troubling news at food processing facilities where new cases plague plants. Nationally, some 5,000 workers in 115 locations have fallen ill. A troubling sign, business as usual is anything but that. Miguel Almaguer, NBC News, Los Angeles.
This is Gabe Gutierrez in Lafayette Township, New Jersey, where Todd Applebaum is a first-generation farmer who says his wholesale business to restaurants is wiped out.
I thought we were going to close, I'll be honest with you.
But now he's found a new lifeline.
If you weren't able to sell at
open-air farmers markets, what would happen to your business?
I would be completely shut down.
He's relying more on markets like this one, where he and other farmers can sell directly to customers, cutting out the middleman.
We actually are looking into online shipping.
Across the country, the meat industry is rattled after processing plants shut down over coronavirus concerns. Today, a major JBS plant partially reopened in Worthington, Minnesota, and a Tyson Foods plant in Waterloo, Iowa is set to resume limited operations tomorrow. But Tyson's stock is down 39% from last year. Nationwide, daily cattle production has dropped 34%.
It's not a supply problem. There's plenty of live animals. It's a supply chain problem. So we can't get those animals to market to be able to be consumed.
That caused beef shortages at a growing number of Wendy's restaurants and prompted meat purchase limits in major grocery chains. Small farmers are now racing to reinvent themselves.
Looks like we're going to be doing more retail and less wholesale, more in the farmers markets, more on the website.
Even as the supply chain breaks down, farmers like Todd Applebaum are searching for new ways of connecting with their customers directly to survive. Lester?
All right, Gabe Gutierrez this evening, thank you. And as more businesses open their doors again, even in areas where the virus is spreading, Jolene Kent tonight on how they're trying to bring customers back and the restaurant chain sparking outrage in the process.
As businesses reopen, there's a patchwork of policies triggering new concerns. Workers at 5 Dallas restaurants owned by Hillstone, a popular national chain, tell NBC News they were told not to wear masks on the job.
We have to stop the spread and everything, so it's probably not a good idea.
I probably would not dine in at a restaurant if the servers weren't wearing a mask.
Outrage spilling over on social media. One customer saying not letting your employees wear masks during a global pandemic is insane. Hillstone did not respond to NBC News' request for comment, but did reply to the post, saying our staff members who felt comfortable working without a mask are covering the limited number of shifts we have available. Those that didn't feel comfortable were encouraged to stay home. Nobody was fired or forced to do anything. On Hillstone's website, the company tells Texas customers, if you are concerned about your safety in this respect, we hope you'll join us at a later date. But in an executive order on reopening, Texas Governor Greg Abbott says businesses and customers should use good faith efforts to follow health protocols and encouraged everyone to wear appropriate face coverings.
The key is following your state or local guidelines. There are a lot of challenges they have to follow, but really just follow the local guidance.
And several big retailers sharing their new plans to keep employees and customers safe. The Gap reopening 800 stores by the end of May, with shorter hours and face coverings provided for employees. And when it's time, registers guarded with plexiglass. Expect similar changes at Kohl's and Nordstrom, and big changes coming to theme parks. Shanghai Disney Resort is opening Monday, the company considering allowing fewer people into its parks at once, more health screenings, and virtual lines to maintain social distance at Disneyland and Disney World. A blueprint for what comes next. Jolene Kent, NBC News.
Now to an NBC News exclusive, an inside look at Homeland Security's National Biodefense Lab, opened after 9/11 and now focusing solely on COVID-19. Here's Tom Costello with that.
It's one of the deadliest pathogens the world has faced in the last 100 years. Trying to crack the coronavirus code is now the top priority at Fort Detrick, Maryland, in the Homeland Security Biodefense Center. Behind these doors, one of the most secure labs in the country. Researchers in full biohazard suits now working to understand how the coronavirus spreads and infects so easily. I asked senior research scientist Paul Dabish about the pressure knowing so many people have already died.
It's very great, we are working around the clock because of that, to try to answer questions that we're being asked about this virus, and hopefully those results can help to inform our response to this, and we know the clock is ticking on this.
Among the most urgent questions, how long does the virus hang in the air and remain infectious? In this aerosol chamber, researchers recreate the sunlight, heat, and humidity levels for any climate in the country, from New York in springtime to Arizona's deserts to Florida's beaches. If the virus can remain airborne, it could potentially spread more easily through hospitals, prisons, meatpacking operations, schools, and nursing homes.
We're most concerned about the really small droplets that you can't see, because those are the ones that get down deep into your lung. And for most infectious agents, that's when you get the worst possible infection.
Those could be deadly.
Those could be deadly.
droplets smaller than a human hair. Researchers already know the virus can survive on cardboard for 24 hours, plastic and steel for 3 days, glass for 4 days. Last month, this lab announced that common household disinfectants can quickly kill the virus. But another critical discovery received less attention. The pathogen does not survive well in direct sunlight and at certain humidity levels.
What we have found so far is that sunlight seems to be very detrimental to the virus. And so within minutes, the majority of the virus is inactivated on surfaces and in the air in direct sunlight.
That could mean the virus would die quickly on anything left outside, from playground equipment to backyard furniture to shopping carts. It's not clear whether sunlight kills the virus on skin.
Our preliminary results say yes, that the sunlight on plastic will inactivate the virus very quickly.
Potential good news for anyone anxious to get outside. Researchers say the fact that this virus dies quickly in direct sunlight but can live for days on surfaces inside could directly affect how Americans live and play this summer.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.